Hi, welcome to another episode of Sex Ed with Mel in 30 minutes or less here at Jefferson County Public Health in Jefferson County, Colorado. So today's episode, we're going to be talking about LGBT health concerns. And what does LGBT stand for? It stands for lesbian, gay, bisexual, and transgender. There's lots of other terms that sometimes go along with these ones, but we'll break it down for you. So the first thing to know is that sometimes gender and sexual orientation and gender expression can come in a whole variety of flavors. So this graphic is the genderbread person as illustrated by artist Sam Killerman. As Sam has illustrated here, a person has lots of different ways of expressing gender and orientation and expression. So the first one that's pretty much easiest to understand is biological sex. Biological sex refers to what's between your legs and the hormones that you have circulating in your body. So a male biological sex would consist of a penis and testicles and the hormone testosterone. A female biological sex would consist of a vulva and vagina, ovaries, a uterus, and sort of circulating estrogen and progesterone. And so sometimes it happens when a baby is born that the genitalia might be ambiguous or mixed, and the term for that is intersex. And there's lots of different ways that this can present. But it's important to know that biological sex can sometimes happen on a continuum as well. So the next one, gender identity, refers to what's between your ears. And so gender identity is how you perceive yourself to be masculine or feminine. So someone who is born with a female set of genitalia, so vagina, vulva, ovaries, and uterus, and who identifies as feminine would be called cisgender. So their biological sex also is congruent with their gender identity, so what's between their ears. They're born as female and perceive themselves to be as female. Someone who is on the other end of that spectrum with a masculine gender identity, who also had a biological sex of male, would be a male person who identifies as a man. And so in between those two things, because just like biological sex can come along in a gradient, so can gender identity, in the middle would be something that sometimes is called genderqueer, but there are lots of different ways that people can identify, and sometimes that changes throughout the course of a lifetime. And overall, that's okay. The next part is gender expression, which is what you are on the outside. So what gender expression refers to is how you present yourself to the outside world and the gender roles and activities that you participate in. So for example, someone who presents themselves as more of a feminine side of the gender expression would perhaps wear their hair long, they might wear makeup and dresses, and do things that we as a culture perceive to be more on the feminine role. So someone who identifies more as a masculine with their gender expression would perhaps have shorter hair, maybe facial hair, and would participate in activities or roles that our society defines as more masculine. Some people don't really fit into either box, and so they might be somewhere in the middle, and that's called androgynous, and that's totally fine too. And so the last one on this graphic is the heart, which is orientation. And what that refers to is who you are romantically or emotionally or sexually attracted to. And so for some people, that they prefer those who have the opposite gender, opposite biological sex, opposite gender, opposite presentation of themselves, and that's called heterosexual, where those things are different. They're on the opposite ends of the spectrum as to who they are attracted to and what they present as. Some people prefer to be attracted to and pursue relationships with people who have the same sets of genitalia or gender expression or gender identity as them, and that would be homosexual, so same-sex relationships. And some people, gender expression or biological sex doesn't matter, and that might be bisexual or polysexual, where they just doesn't matter what you are between your heart or between your legs or between your heart. It's, you know, what's inside that counts for them. And so people can come in all flavors, and it doesn't necessarily mean that having one set of things, like say having one set of genitals, necessarily means that you identify as what is medically assigned to you at birth, and that's okay. And sometimes that can change, and people come in all shapes and sizes and colors, just like a bag of Skittles. It wouldn't really be great if there was only red and green ones, right? Regardless of how you identify, whether that's biologically, gender expression, gender identity, or sexual orientation, there's going to be health concerns that you might have. If you're having sex with someone who has the opposite biological organs as you do, then pregnancy is definitely something that you can be concerned about. And so if you're going to be sexually active with someone who has the opposite set of genitals that you do, it would be important to take precautions to avoid a pregnancy if it wasn't something you were ready for yet. Or if it was something you were ready for as a couple, then to pursue that with your healthcare provider. And again, regardless of your gender expression or your sexual orientation, sexually transmitted infections do not care about those things. And sexually transmitted infections can happen in same-sex relationships as well as opposite-sex relationships. And so if you're going to be sexually active with anybody and you want to avoid an infection, it's a good idea to do that by using protection, which would include, condoms, either of the insertive or receptive variety, so male or female condoms, would include using things like dental dams or safer sexual practices, like limiting the number of partners you have or choosing not to be sexually active at all, which is called abstinence and is the only 100% effective method of prevention. HIV is also a concern that can be had with anybody of any flavor can possibly be exposed to HIV if it is through those fluid-to-fluid contact. And if you need more information about how to prevent STDs or HIV, check out our STD video. And another thing that can be concerned with of anybody of any flavor is healthy relationships. If you choose to be in a partnered sexual relationship or even a partnered relationship that doesn't include sexual activity, it's important that you feel supported and loved and respected in your relationships. And if there's something going on that doesn't sit right with you or your heart, then get the help you need. Access to health care is definitely something that's important, no matter who you love or who you choose to have sex with. And so sometimes it can be scary to be honest with your healthcare provider as to the nature of your relationships or the nature of how you identify if maybe what your body looks like isn't how you perceive yourself to be. But it's important to be honest with your healthcare provider about these things so that they can have all the information to provide you with the best care and information that you need to keep yourself safe and healthy. One way to tell if your healthcare provider or your healthcare provider's office is inclusive is to see what kinds of symbols or imagery they might have up in their waiting room. Do they feature same-sex couples? Do they advertise as being inclusive? Or maybe do they have the equality zone triangle or other symbols of the LGBT community that would identify them as inclusive? Now, not all healthcare providers might have those necessarily, but are still going to be supportive of your health and supporting you as their patient, being the best you, healthiest you that you can be. Sometimes you can ask reception staff. That might be helpful, but another way to tell is through the Gay Lesbian Medical Association, GLAMA, glma.org, contains listings of known inclusive healthcare providers. And of course, not everybody is on there, but it's a good starting point if you're not sure where to go and don't have any recommendations from friends or family. And it's important for you to know that Jefferson County Public Health is an inclusive organization, and we are committed to providing the same standard of health care and support for everybody, regardless of how they identify or who they love. If you want more information about these things, give us a text on the Go Ask Tish text line, give us a call to schedule an appointment, or visit the Before Play website. Thanks, and we'll see you next time.